because your health matters.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
And a very good evening to you. This is Dr. Gerald Thompson with Your Health Matters. This evening, I feel that as a matter of request, I want to talk about the heart. I want to talk about heart attacks. In fact, I want to talk about how do you know if you are having a heart attack. This is an interactive program. I'd love to have your calls, 457-9997, WhatsApp, or straight direct call. We'll certainly be happy to talk to you on any subject. But this evening, we're talking about the heart attack. And everyone should realize the heart is probably one of the most important organs in the body. What does it do? The heart is really muscle. Share muscle, and it's engineered and designed, and the way the Lord made us, it's designed really to pump blood in a particular manner, a sequential, organized, regular manner, so that our body is supplied with blood that has the nutrients and oxygen in it. That's what it is. The heart is a pump, pump. And it's beaten to pump blood around the body. Now, this is the important thing. The heart has two sides to it. One side pumps blood to the lungs, so that the blood there could be refreshed with oxygen. And then the other part of the heart pumps that same blood that has been collected back from the lungs, now rich with oxygen, pumps it to the rest of the body. You don't want a heart pumping blood that doesn't have oxygen in it, doesn't have nutrients in it to the rest of the body. That's a waste of time. You know what I mean? Now, what I want to get at is that while that's the function of the heart itself as a muscle needs oxygen and nutrients too. And so the heart has its own blood supply. The heart has its own blood supply called the coronary arteries. And these coronary arteries, let me hold it up. You see this cord? This is the cord for my laptop. These coronary arteries about as thick as this. Imagine these important blood vessels. They're just like this thick. And they are getting blood, right? Oxygenated blood. And blood is reaching the heart muscles themselves. And if there's anything wrong with these coronary arteries, then the heart as a pump starts to fail, starts to dysfunction. It can stop pumping. That's the important thing. Now, heart attacks and heart failure can be managed with the right treatment and a substantial amount of adjustment, but it must be timely adjustment, timely interventions. And that's what we're going to talk about today. And so I'm going to start off by telling you a little bit about the symptoms of a heart attack. Then we're going to go into a bit of the cause. We're going to leave the diagnosis and treatment of a heart attack for another time. I don't think we'll get through all those things right now. So if you believe you or someone is having a heart attack, you should call emergency services. If you're in England, it's 999. If you're in Canada or the United States, it's 911. Although if you call 999 in Canada, you still get something, you know? In St. Vincent, you have to call 61185. You know, that's the hospital. We don't as yet have one of those 3-digit number. There's lots of plans, and so I'm hoping it will come up soon. You know, that from a cell phone without any credit, also you could call an emergency number. That's something that's really been needed for a long time. I hope it really comes around. And so if you think you're having an attack, or someone close to you, or someone that you have met who seems to have an attack, the important thing is you call an ambulance. You call the emergency service. There's no shame if you call the ambulance and it was a false call, it was a mistake. You're not a doctor and so forth. So therefore, calling does not hurt. But if you are calling, that person is having a heart attack or a serious medical problem, then boy, you are a hero, you know? So what are the symptoms of a heart attack? You know? And what I'm saying, the faster you act, the better the chances. The faster you act, the better the chances. So the symptoms of a heart attack, let me start off. A heart attack, number one, pain, chest pain. But this chest pain is not the usual type of chest pain. It's a feeling of pressure. It's a feeling of heaviness. It's a feeling of tightness or squeezing across your chest. It's feeling like someone sitting on your chest. In other words, this is not a sharp knife-like pain. Come on, this is not a choke. This is not feeling as if something's cutting you. It's more of a dull pressure-like pain. And guess what? The pain can have many characteristics. The pain can not only be in your chest, the pain could also fool you and be in other parts of your body too. You know, the pain can, what we call, radiate. It can feel as if it's moving. Sometimes it can move up to your jaw. It can move to your back. It can move to your shoulder. Most of the time, or let's say the most common way it moves down your left arm. You understand? To your fingers. And when it moves your fingers, you can sometimes have tingling in your fingers. The person will say, I feel a tingling in my fingers. The pain coming on, I feel a tingling in my fingers. That's the characteristic transfer or radiation or radiant or referred pain. Now, the interesting thing is that the pain can occur in these places without having chest pain. You have pain in your jaw, pain in your back. Pain can be in your arm, but not in your chest. But usually it can be, the characteristic is it's in the chest and these other places too. Maybe one or more of these other places. And usually it is your left arm, but can be both arms, right? Now, in addition to pain, you can start feeling lightheaded. Think about it. If you're having a heart attack and your heart then is not functioning properly, could you imagine you're now beginning to feel lightheaded? You can start feeling dizzy. Now, in addition to this lightheaded and dizziness, you can start feeling sweaty. It could be a cold sweat, or you could start developing what we call diaphoresis. Now, let me break that word down. I mean cold sweats. Come on, you ever heard of cold sweats? Cold sweats. It ain't that you're hot. It's not that you're hot. It's cold sweats. Sweat start to appear on your forehead and in the palm of your hands. And then you can have shortness of breath. Remember I told you that the heart is important. One part of the heart pumps blood to your lungs to get oxygen. Another part that has collected that rich oxygenated blood pumps it to the rest of the body. Well, if that part of the heart that's supposed to pump blood to your lungs isn't functioning properly because it's going through early heart attacks, then you could start feeling short of breath. Or if you are certainly exerting yourself, shortness of breath on exertion. Sorry. And then all this going on, you could imagine many people are going to feel anxious, an overwhelming feeling of dread. You know something is wrong. You know something is wrong. So you start feeling anxious. That's part of what also gives you the cold sweats and so forth, the anxiety. And you start feeling as if you're having a panic attack. But it's more than a panic attack. You could sometimes have coughing and wheezing. But the chest pain, the important thing with the chest pain is that it's usually severe. It's usually a severe chest pain. Makes you've never had that before. It's squeezing, the pressure. Someone's sitting on your chest. Somebody's standing on your chest, pressing on your chest. Their foot standing up on your chest if you're lying down, you know? And at the same time, there's some people who hardly have any pain at all when they're having a heart attack. It's a minor pain, as I said, just in your jaw, just in your shoulder or something like that. So while most common symptoms of chest pain can vary from person to person, some people may have other symptoms, as I said, such as shortness of breath, feeling of being sick, feeling nauseous, feelings they want to vomit, actually vomiting, the pain going through the jaw, going to the back, you know? And as I said, it's not a sharp pain, it's a dull, squeezing, pressure-like pain. Now, before we go into more things, what's causing this really? What's the cause of a heart attack? Well, to be clear, throughout the world, the most important and prevalent cause of heart attack is a blood clot developing inside one of these small coronary arteries. See how small they are? Imagine a blood clot inside there. And as a result, the blood cannot flow to a big section of the heart. And that's a serious symptom. Without blood flowing through those arteries because of a clot, because it's clogged, the heart muscle that's supposed to do the pumping either cannot pump properly because it's becoming damaged, it's beginning to die, and if left without treatment, that heart muscle can experience irreversible damage, irreversible change and damage. And as a result, a large portion of the heart may become so damaged in a way that that part of the heart starts stopping its beating, its regular beating. When your heart stops beating, it's known as a cardiac arrest. Cardiac arrest. And if that occurs, it can often lead to something we call death. That's the important thing. Now, coronary artery disease or coronary heart disease, called CHD, is the leading cause of a heart attack, is the leading cause of a blocked coronary blood vessels. And what's happening is that over a period of time, from the time you are very young, depending on your diet, depending on how you're eating, depending on your lifestyle, what's happening is that we call fibrofatty tissue. I'm sorry. Fibrofatty tissue starts to become deposited inside the blood vessel wall. And it forms a plaque, forms a scab. Now, during a heart attack, inside the coronary arteries, I want you to understand that the scab can rupture and break off. You know, come on, let me ask you. You ever had a scab and then you don't know why you do it, but you break off the scab? Or have you ever had a scab in your nose and it feels funny, so you pick at it and you break off the scab? What happens to afterwards? It starts to bleed again. Well, anytime those scabs, those plaques inside the coronary arteries or other blood vessels rupture and break, there's some bleeding, but most of the time what happens, it forms another scab, a blood clot. But the blood clot can be larger than you actually think. Same way you ever remove a scab and then you find it's bleeding so much your whole nose get blocked up. Your whole nose. Well, imagine in the blood vessel, the whole blood vessel gets blocked up by a blood clot again, ready to form another plaque, another scab. But what it's doing, it's blocking off these tiny but important coronary artery blood vessels. And the clot is narrowing and preventing a proper amount of blood from passing through that blood vessels to supply the heart. And that's the reason why you will find that the heart muscle now cannot get enough nutrients, can't get enough oxygen, can't get enough blood. And so as a result, it starts to dysfunction, it starts to die, and you don't want that heart muscle to become totally dead. You want to make sure that the blood vessel opens back up quickly to allow blood to flow back through again. If you don't, that heart muscle will die because the clot is preventing blood from reaching that heart muscle to nourish it. And if that heart muscle dies, you can have cardiac arrest, as I've been stated. So your risk of developing, is that called? Your risk of developing coronary artery disease is further increased by smoking. Having a diet that is high in cholesterol or refined sugars that's going to be converted into other fatty type tissue. And tell you, these type of things in your body, we weren't meant to eat a lot of these processed foods and refined sugars and high fructose corn syrups and so forth. These inventions we've had over the last 30, 40 years. It tastes good. It tastes good. It tastes nice and sweet and wonderful. Boy, the body's not breaking them down in the right way. And they're forming some fiber fatty tissue. They're forming cholesterol. They're forming other type of fats that are being deposited inside our blood vessels. If you have diabetes or high cholesterol because of your genetics, this will cause the same thing. If you have high blood pressure, and certainly if you're overweight or obese, then you're going to have a lot of excess of these fats running around your body, and they're going to be deposited inside the blood vessels. Now, another reason why people have heart attacks is if they're in a situation where there's a lack of oxygen. Now, this is less common than a heart attack that's due to plaques. This is in a situation where there's not enough oxygen about the place. This is if you're in a car or in a room and you don't know that carbon monoxide is being released inside that room or in a car or whatever, and that carbon monoxide poisoning is going to cause the same type of thing. Or if you are at the top of a mountain where the oxygen level is low and you have some of these kind of conditions, all these things could be. So having low oxygen around you or being placed in a situation where there's not a lot of oxygen around you, either from carbon monoxide poisoning or being at the top of a mountain in Bolivia, La Paz, or Denver, one of those places. But another important cause, a third cause, but very rare, but still common enough, is coronary spasm. Remember I showed you about these blood vessels? Well, imagine if the muscle in these blood vessels went through a spasm. Kamal, have you heard about that before? Your coronary artery, they go through a spasm. You've heard of a back spasm. You've heard of muscle spasm. Well, I want you to understand your coronary artery could go through spasms too. And it's rare, but it's common enough. And it could cause a heart attack when there is no plaque obstructing the coronary arteries. So while most heart attacks stem from a plaque buildup, severe spasm can also cause intense, sudden chest pain. We call this, prinzimetal angina, but you don't want to know about that. The thing is that this is very serious, but I want to explain that sometimes this is caused by certain medication, certain drugs, especially cocaine and amphetamines. Cocaine, there's been a number of basketball players who used to take cocaine, they go out and play, but the cocaine caused their coronary arteries to go into spasm, and they had a heart attack right on the basketball court, And spasms of the coronary artery seem to be a little bit more common in women, and strangely enough, in Japanese culture. So they have a little bit more of it. Now, I've brought this up because I've told you about the symptoms of a heart attack. I've told you about some of the causes that could trigger a heart attack. Some things can happen very suddenly, like a spasm, but other things build up over a period of time because you have not been doing the right thing for 10, 20, 30 years, and plaques have been building up slowly inside your blood vessels, especially in the coronary artery. But now, let's say you're having your heart attack, or you have a relative who's having a heart attack. What should you do? Kamal, this is so simple. This is so easy as a question. What should you do? The first thing is you should call an ambulance. If you have a heart attack, it's important that you rest while you wait for an ambulance to avoid any unnecessary strain on your heart. If you have a heart attack, don't rush to pack some clothes. You know what I mean? Don't say, well, let me go to the bank first to draw out somebody before I go to the thing, Don't start to think about anything other than just relaxing, resting. And if you have a relative who's having a heart attack, a friend, you got to calm that person down. You may be interested in rushing that person to the hospital and trying to get them there. But the chances are that if you wait for an ambulance and the ambulance comes, the ambulance may be able to get you to the hospital faster than you would be able to get that person to the hospital. Clearly, if you are 100 yards from the hospital may be the best place. But if you are 5-6 villages away, 2 towns away, it's important you get to a health institution, a hospital. But sometimes getting there, it'll be good if inside the ambulance they put the patient on oxygen. They're able to put up a drips. They're able to do other things in the ambulance there that they could do. You driving them may not always be the best. Sometimes it is the best, but it may not always be the best. And so I want to recommend to you that you try and keep the person calm. Double check on the ambulance. I know it can be frustrating because it feels as if the ambulance is taking an hour to come. It feels like if the ambulance is taking an hour to come. And how far is the ambulance? Is the ambulance down? Is the driver with the ambulance take the day off because he went to a party last night? You ask yourself all these kind of questions. Now, the second thing is that if you suspect this is a heart attack, if aspirin is available and you are not allergic to aspirin, let me say that again. If aspirin is available and you're not allergic to it, slowly chew and then swallow an adult size aspirin tablet while you wait for the ambulance. There are going to be patients who may have been having some signs of heart problem before, who are on what we call small baby aspirins, right? And they should be taking those regularly. Sometimes, guess what? They stop because they're fed up, or they all finished with medication, so they don't take it for a couple of months. But if you're not one of those patients who normally gets a baby aspirin, take an ordinary aspirin, chew it, and then swallow. The amount of the aspirin that is going to be absorbed, all of it, those regular aspirin are about 300 milligrams, let me tell you that. But what you really need is about 81 milligrams, about 1/3 of that. But because you're chewing it and taking it, all is not going to be absorbed immediately. But what you take can have a real important effect on your body. What aspirin does in small doses is to thin your blood. Aspirin in small doses is not for pain. It thins your blood and helps with your heart. I think we have a call. Do we have a call now? I think we missed that call. Caller, you can call back. So aspirin is important. Now, I got to get into another section. Suppose the person goes into cardiac arrest. In some cases, let's take the call. Okay. Oops. Hello, good evening.
Hey, good evening, Dr. Thompson.
Good evening, yes.
No, I have a little problem,
Sure.
No, I used to smoke and things.
Yeah.
Right long time.
Yeah.
Long time. But now, when I used to smoke, before going to what I want to say, when I used to smoke, sometimes a cigarette with gas, like you want to come to me age and put my stomach and all kind of thing. In for me nicotine.
Yeah.
So I done it smoking for a long time. But if I smell smoke and thing now, like the same thing that want to come and affect me.
Yeah.
But what happened? Every time now, like I drink too much of cold water. Cold water is a danger to a human being. You know?
What?
Cold water.
Cold water?
No ice and things. Like if a man feeling too much of ice and things, somebody your throat is dry.
Uh-huh.
You know that?
I'll tell you something.
Plenty ice.
But okay, I'll come back. I'll come back to that in a minute. But you finish up and then I'll be coming.
Yeah, well, what happened now? Sometimes when I drink cool water, I drink water in night. Because I'm diabetic and somebody called for water.
Yeah.
You know, sometimes I feel a dizzy coming inside my throat. And then sometimes I come like I start to get tired. And I got to sit down and rest. If we're in the garden or what. But when I don't rest out, sometimes it gets over and I try to move again, as usual. Hard and fast. But where do you think that, where that really coming from? Because when I drink water sometimes, I drink some hot tea. Sometimes I feel like I kind of think I'm black. We wanna come up inside me lung like a coal or something, a gas or something, and then after they start to feel tired. For what later about say 6 minutes, I might have to lay down for a quarter of the time, and then when it's gone, I'll go back in the garden and walk. But then it will affect me. Sometimes we balance it again. What really causing that?
Well, first of all, you said you are diabetic, and you haven't mentioned whether you have a double whammy of your hypertensive as well. Are you hypertensive?
No, I ain't hypertensive.
Yes, yeah.
Just the sugar.
Yes, the sugar. And sometimes it's very difficult to tell what's going on with somebody if your sugar is running low or your sugar is running high or very high. You know what I mean? Now, water is so important. It's a food. It's important in our body. So much of our body reactions depend on having water around. Water hydrates you, and diabetes sucks the water out of your tissue. So at night, your mouth's gonna feel dry. You're gonna feel thirsty. As a matter of fact, your urine is gonna get more concentrated and yellow and so forth, and things like that. But drinking room temperature water is the best, but there's nothing wrong with drinking cold water. I'm a cold water drinker. You understand? And it isn't that cold water is bad, but sometimes the water can be too cold if the water is icy cold and so forth. You know what I mean? So there's nothing wrong with having water with a little couple of ice cubes in it, but taking the water out of a freezer and you're waiting for it to thaw out and so forth, and it's there. It's best if it's a little bit more towards room temperature and so. But it isn't a negative as such drinking cold water. So some people say drink warm water. That's not necessary, but we drink warm water with tea and so forth. So that's also okay. Most of tea is 95% water. So there's nothing really wrong with that. But it's difficult to determine what is actually taking place with you. I imagine you're a person who goes to a doctor every month, right? You're not a person who tries to read up and treat yourself and so forth. You actually have a regular doctor and you go to see him once a month. Is that right?
Yes.
Huh?
Yes, I go to once a month.
Okay, I was expecting you to tell me no, doc, I don't do it.
Well,
I'm a man's man. I don't go. I go to a doctor maybe once a year or something. I thought that's what you would tell me. So I was trying to poke in you a little bit there, But
yeah, but I chew you saying because when I get my medicine, I haven't done before I go back.
You have to done before you go back. And he give you 3-4 refills and so forth. You go back to the pharmacies and give me more of this. But we're trying to encourage men to go and get more regular checkups, even though they're having unusual symptoms and unusual things that are taking place in their body. And the things that might be just age-related, and things that are related to their diabetes and things that may be something new that's coming on, So I want to recommend that you sound like you are a person who is very much into health and healthy living and things like that. You're now moving on to doing some of the right things. But it's good to double check things. It's good to double check and have someone check it for you and give you any kind of inspiring. Find a good doctor. If you're not happy with your current doctor and so forth, which I'm sure you are, but you can always find somebody good and so forth too. All right?
I take advice, but I tell the doctor right up 3 times you write a paper for me to one blood test. I say, boy, I all right idea. I wonder if you.
No, but listen, can I stop you? Can I stop you there? Can I stop you there, please?
Huh?
The doctor. I was about to go on. The doctor maybe write a blood test. He will find out what is your cholesterol level.
Yes, I know that.
He will find out really how high your sugar is. Is your sugar a little tiny bit high? Is it moderately high? Or is it very high? He will do a hemoglobin A1C. Does it call that? He wants a hemoglobin A1C. He wants to check that he's telling you the right thing. So can I humbly beg you on behalf of the doctor, go take those blood tests. I mean, they may cost you a couple of $100 and so forth, but take them because a stitch in time can save 9. You understand?
Yes.
And I really want you to go and get those blood tests and then go back to him and say, hey, doc, what do you think? I'm going to live until 110, 120. Ask him that. Yes, sir?
No, I want to live 125.
Yeah. All right. Okay. Thank you very much. All the best.
So might be able to move around still, eh?
So, yeah, you might be able to do much more than that. Move around till you could do a few other things. Talk to you, okay? All right.
Okay, man. Thanks, man.
Right, okay, bye. Yes, we missed a couple of calls there and so forth. Sorry, but I wanted to finish off with that caller there because, in today's world, as we start to read and we learn a lot more about health, we develop all sorts of ideas. People give us advice. Drink hot water, drink cold water, drink this bush, take it up. But ultimately, you can do lots of those things, but still have a medical advisor at the same time. And if the doctor writes a prescription, I know sometimes things are a little financially tight, but go get the test, man. Go get the test so that you're embarrassing the doctor. Well, let's take this next call. Hello, good evening. Yes, hello. Hello, good evening. Good evening.
How are you doing, Dr.
Not too bad at all. How are you?
I'm good. I'm still on the land of the living, listening to you.
Well, boy, I tell you, this is the right place to be. I don't want to be in the other land. You know what I mean? Yet.
But before I say what I had to say, let me really I lift off my hat to Kamal. He's there?
Yes, he's there.
Congrats to, I don't know if you organized this program tonight, but I salute you. Okay?
Kamal, okay, all right, yes.
From last night, from that lady, I saw you act promptly, and I really salute you.
Kamal, there's a program.
You sure you're referring to me?
You was Kingsley last night, right?
Yes, I was on Kingsley's. Oh, okay. All right. I understand. I know now.
Somebody behaved badly, eh?
No. I know what he's talking about.
Okay, all right. Okay.
It was all good.
good. All right.
You're spreading out with business, man. You acting like you don't know what's going on.
No, I wasn't so sure.
He didn't catch on yet. Yes.
Yeah. Wonderful
Reaction.
Wonderful program.
Producer.
Wonderful program tonight. And in fact, stem from last night, I did plan to call you tonight to encourage you to have a program like what you're having tonight, but
okay.
Kamal run faster than me, so
okay,
it's all good.
Yeah, right. Yeah, come on as a producer. Yes. Let me hear your question. If you have yeah.
No, we gotta have a discussion.
Okay, go on.
Not a question. Can someone heart recovers after a heart failure, whereby they don't have to use what you call a defibrillator?
Okay. Now we're talking about several things there. Remember, I had said that when somebody has a heart attack, the blood flowing to the heart muscle can become diminished. And when the heart muscle ain't getting enough blood, it like starts to die, you know? But if you pull it back from the brink, therefore that muscle recovers. Whereas if it goes too far, little pieces of the heart muscle could become permanently damaged. Now, if a whole set of heart muscle is damaged, what you have is a cardiac arrest and the person usually dies. But if a little piece of the heart muscle is damaged, then, you know, that part of the heart muscle can sometimes get very sensitive and start to go wild, start to pump crazy, and start to throw off all kind of funny beats. And these funny beats themselves can lead to cardiac arrest. And it is in those situations we usually have to put up a kind of a cardiac defibrillator or to keep the heart beating at a certain rate. You understand? Now,
yes.
So it depends, one, on the extent of damage of the heart muscle, how much, whether that heart muscle damage is triggering abnormal beats, whether it's causing the heart to do boop boop, stop, boop boop, or whether it's causing the heart to just stop beating for a couple of minutes. You don't want that, or whether it's causing the heart to do boop 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 boop, to beat funny fast. You don't want it to do those things, you know. So your pacemakers and so forth are sometimes involved in those kind of situations. Now, and then using medications as well could also help the situation. So the answer to your question is that yes, after certain types of heart attacks, the heart actually can recover by a number of means. Usually, it may also mean that you have to do a rota, plumb out the inside of the coronary blood vessels. You don't want that to get blocked up anymore. Yes, sir? And sometimes you have to change the coronary arteries, put in some new coronary artery blood vessels. You know, sometimes you have to put in just something to keep them open, called a stent. But usually it involves a lot of medication, and it involves also a change in lifestyle, because you don't want to do all this and the person going back to eating a whole sort of fiber, fatty foods and so. You know what I mean?
I don't know if what's his name? Kamal. I called the program last night after the lady called, and I was saying to them that she got to change her diet completely. She got to cut out salt and all these kind of things.
Yeah.
Because you got to live a healthier life at that point.
Yeah.
And take the medication correctly.
You've hit an important nail on the head. The amount of patients that recover from one of these episodes, a heart attack, and they go right back to the old lifestyle. And there's some people say, you know what? I'm going to go anyway. Let me enjoy myself for the last. There's some who have that attitude, but there's some who really have addiction, especially smokers who continue smoking, right? And persons who may also be obese. It's very difficult for them to change that lifestyle. And there's a lot involved. Sometimes psychology, psychiatrists need to be involved, dietitians as well, to help that person really adjust. Because going through a coronary bypass, doing all that surgery for thousands of dollars and so forth, and so you go back and you block it up again a second time. That's not a good idea.
And Dr. Gerald, one thing that humbug us is secondhand smoking. You know, secondhand smoking kills. It may sound simple, but it's really dangerous to non-smokers.
Yes.
When they have a heart problem.
Yes.
You know.
Yes.
The next thing I want to say, because I don't wanna hog up your line too much.
That's all right. That's okay. You know, it's very important call. Very important call. Yeah.
I don't want Jules to charge me for his line. Okay.
Okay. All right. We'll talk to him.
And thanks. Dieting. There are times to change your diet.
Yeah.
And you not get that taste. But you have to say, listen, am I need the taste or am I need a longer life?
Yeah.
Your taste bud's gonna grow to adjust to the new food, to your new diet.
Absolutely.
So changing the diet is very important, but don't worry about the non-salt. You could use herbal seasoning to season your food just as good as what we used to use the regular seasoning.
Yes. Yes.
You know, very important because it's what we put in our body gonna keep us.
Yes.
You understand?
Mm-hmm.
And it's very important. I'm talking from this point of view because I have the experience.
Well, okay? I was wondering that myself, you know. Thank you very much for that. I mean, I would normally go into much more deeper detail as I suspected, but we'll let you go. And I want to thank you very much for that.
One more thing.
Sure.
There are times they may able to put a balloon in you to revive your heart, to pump your heart for a period of time.
Yeah.
Don't worry. You're gonna be good. You know, you could explain to the audience about all these things.
Yes.
You know, very important. Good program. Kamal, one more time, I salute you. Have a good.
Thanks. Thank you very much. All the best. Okay. You know, that call came in just as I was about to discuss cardiac arrest, because I was making the point that in some cases, a complication called ventricular arrhythmias, that is, arrhythmias mean abnormal heartbeats, can cause the heart to stop beating. And this is known as a sudden cardiac arrest. And the signs and symptoms of somebody with this sort of thing, a sudden cardiac arrest, is that they appear not to be breathing. Let's take this other call. Hello, good evening.
Good day.
Good day, Kojo. Yes, how are you? Yes.
I want to, because where I work, they teach us CPR.
Yes.
And another form of CPR they teach you, which is called self-CPR.
Self-CPR. Okay, interesting. Yeah, go on. Tell us about that.
Okay, so if you were to be having a heart attack or anything like that, the self-CPR is that you take a lot of deep breath and cough.
Okay.
Just like if you're pumping your chest.
Yes.
And you're blowing air in the person. So what you do is that you take a lot of air in and you cough.
Yeah.
And you do that, it prolongs your life a little bit. So by the time help come, you won't be totally gone. So it helps you with that. They call it CPR.
Yes.
So you never heard about it, Doc?
Yes. I think that sometimes, Kojo, techniques, if somebody has gone through this sort of thing before and they're trained and they know about it, that's one thing. These things are not so widespread. And so somebody may therefore do the wrong thing. You understand? Now, I had recommended that the person try to rest. In other words, you're having a heart attack, you should not go and try to do some push-ups. You understand? And some sit-ups and some press-ups, hoping that, well, boy, that might stimulate me a little bit. And so there are persons who might be prone to do some abnormal things, thinking that's the right thing to do. I prefer them to try and relax and rest, because they may not absolutely know if they are actually going into a cardiac arrest. It's hard to know if you're actually going into a cardiac arrest. But if you're having a heart attack, I think we got a lot of noise in the background.
Okay, sorry.
Yes,
sorry about that.
Yeah. And so that I want to more encourage that persons relax and rest whilst they're waiting for the ambulance. And that,
but the reason why they teach us that is because if you, like Terry said, you're driving in a car.
Yes.
And you're in the car, you're in a sitting position already, and you're having a heart attack, or you feel you're having a heart attack. They say it's best that you actually start doing self-CPR.
Yes.
Just in case, because it will help regardless of what. It won't hurt you.
Yes. Yes.
So by the time somebody notices that you're having problems and they call 911 or 911 and the 911 ambulance comes, you probably might just help save yourself without, So it's like another form of preventative help, somehow to help yourself while you're waiting for the ambulance. That's all it is. It's not, once you learn about CPR now, that's what they teach you too.
Now, Kojo, I hate to do this, but what I have to tell you is that is a nice method. Somehow, the American Heart Association doesn't recommend it, right? But for persons who have some experience in terms of what to do, for somebody who has not heard about that before, no understand techniques, they may end up doing it the wrong way, But in general, why it is not widespread push, and it's more of an internet phenomena that, so you see it on the internet being promoted and so forth by various pundits.
No, I'm CPR certified. When I did my CPR,
I know. When you did it, did you find that it was part of the American Heart Association training recommendation, or did they say that? Well,
it's part of our training, our job, because like say for instance, I got training to see if someone, because when you're working in the jail environment, you have to look and see if someone is suicidal. There's a lot of things you get training in my ear. So I'm not a doctor, but they do give you small courses, small training. So that's why I know about the self-CPR.
Yes. Okay.
Well,
listen, I tell you something. I'm glad you've introduced it. And basically, some persons will check it out and so forth and see and examine it. I think it's a good intervention and so forth that you brought it up, and persons will check this out.
Okay.
All right. Yes. Thank you very much, Gojo. Yes, there are a number of things. I want to just reiterate. One of the more important things is that whilst you're waiting for the ambulance to arrive and you are awake, you're breathing, then basically rest. There's probably no need for anybody to press on your chest right there if your heart is already pumping and you're already breathing. The concept of self-CPR is recognized and so forth. I want person to read up on it and to dig a little bit more details from it and see really if it is something that they would ascribe to if they were to ever find themselves in a situation. But I want to recommend early call of an ambulance. Get into that ambulance early. Get into the ambulance where they can throw some oxygen on top of you, a mask. Basically, they can throw in the drips and so forth, and they give you some medication. You're telling the doctor what medication you're on just in case and everything like that. And then when you get to the casualty department, emergency, they're all ready for you to do whatever. You do the EKG, check your heart out, see if it's beating fast or slow or whatever the case might be. And then they could take the right action. Every single step has to be done in the right way. We're going to call them. I think we're at the end of the program. I'm sorry, caller, we got to skip this call. We at the end of the show. I'll be coming back next week, talking a little more about that, getting more into diagnosis and treatment. How do we know you've had a heart attack itself? What blood tests do we do? You know what I mean? Just because you have pain in your chest doesn't mean it's a heart attack. Could be, but how do we prove it? How do we make sure? Why some people, they go into a casualty, boy, I'm having a heart attack, but they send them home the same night. Whereas some people, just keep them for 4, 5, 6 days. Well, we'll dig into it next Wednesday. We'll dig a little bit more into that. This is Dr. Gerald Thompson signing off. I want to bid everybody a very special, healthy good evening. Take care of your heart. Take care of your body. Your health truly matters. Thank you.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located